A very good morning to you all. Welcome to the online classes. So I'm Dr. Sudeepa, Professor in Community Medicine. So I'm going to take a class on school health services and adolescent health. So let's see what are the different school health services which we can offer. So coming to the introduction. So it's an important branch of community health because today's children are tomorrow's future generation. So it is an economical and powerful means of raising the community health because majority of the children or majority of the population belong to this age group, and it is a personal health choice. So now what are the different health problems of school child? So every country has different health problems of a school child. So the health problems pertaining to India are these are some of the few of the health issues. So one is related to malnutrition, and then infectious diseases, intestinal parasites, and diseases of the skin, eye and ear, and dental caries. So now what are the objectives? So any health program will have certain objectives. So the promotion of positive health is one of the important objective in school health service, and prevention of diseases, early diagnosis, treatment and follow-up of defects, awakening health consciousness in children, and provision of healthful environment. So now what are the aspects? So to achieve these objectives, what are the various aspects which has to be covered? So any school health service or any health program for that matter will have defined objectives and the different strategies or aspects which we are going to cover to achieve those objectives. So now let's see what are the different aspects of school health service. We have around 12 aspects of school health service which I will be telling you all in detail. So now the first aspect is health appraisal. So health appraisal of school children is very important, and it is not only the health appraisal of school children, it is also health appraisal of the teachers and other school health personnel who are there because they form the immediate environment of the students. So what exactly do we do in health appraisal is periodic health examination, and it is a teacher-centric approach. So these are the two important points. So now what do we do in periodic medical examination? How frequently it should be done, and who does the periodic medical health examination? So it is done at the time of entry to the school and thereafter for every 4 years. So and the initial examination is done in the presence of parents, and it is assisted by the class teacher. So of course the examination will be done by a medical officer, but the school teacher assists him or her in recording the data and measuring the height, weight and so on. And as I said, it is health appraisal is a periodic medical examination, and it is a teacher-centric approach. So what do we mean by a teacher-centric approach? So yes, we do initial health examination. As I mentioned, it is once at the time of entry and once every 4 years. So what happens in between? So in between, so it is a teacher's responsibility to conduct daily morning inspection of her students in the class, so which gives a clue to suspect pupils from any illnesses. So what are the different symptoms which the teacher is going to look for, and how does she know what is she supposed to do? So she does undergo a training during her teacher training. So there is a separate training given to her with respect to these things. So she has to look for these symptoms which are unusually flushed face, any rash or spots, symptoms of acute cold, coughing and sneezing, any sore throat, or any rigid neck, nausea and vomiting, red and watery eyes, and any headache if the child has, diarrhea, any pains in the body or pediculosis. So these are the common symptoms which she is going to look for. So now the second aspect. So the first aspect was health appraisal. So does health appraisal doesn't make any sense if you do not have remedial measures and follow-up. So no matter you do periodical examination, no matter you do daily inspection, but you need to have remedial measures and follow up for those issues. So that is the second aspect. So where do you deliver these remedial measures? So we do have special clinics. So in the rural areas, the special clinics are there at primary health centers. In urban areas, these special clinics can be set up at one of the selected schools. So in India, we mainly focus on the specialist care with respect to dental problems, eye problems, ear problems and throat defects, because these are the common illness which is seen amongst school children. So once health appraisal and remedial measures and follow-up are done, the third aspect of school health service is prevention of communicable diseases. So how do you prevent communicable diseases? Yes, through immunization programs, and you have to maintain immunization records also. So now the fourth aspect is healthful school environment. As we focus on housing environment, and you all do a lot of family studies in your fourth term, looking at the housing environment of each and every household. Similarly, the school environment also is very, very important. So why is healthful school environment important? So it is for the best emotional, social and personal health of the pupils, because they are going to spend most of the time in the school. So what are the standards for sanitation in the school? So there are certain set standards. So coming to the location, so a school should be located centrally so that it is easily accessible for all the students, and at the same time it should be away from crowded places like markets, malls, theaters, etc. And it should not be on a low-lying area. It should be on a high area so that there is no water stagnation. So what is the recommended area? So when it comes to the site, it is around 10 acres for higher elementary and 5 acres for primary schools. So what would be the structure? So the wall thickness of each classroom should be around 10 inches, and the classroom should accommodate a maximum of 40 students in a class, and the per capita space should be more than 10 square feet per person. Coming to the furniture, each student should have an individual chair and a desk, which should be comfortable enough for the student to sit. And coming to the doors and windows should be 2 to 6 feet from the floor, and window and door area should be 25% of floor space. Ventilator should be 2% of the floor area. So all these three things will ensure that there is adequate ventilation and adequate cross ventilation as well. And coming to the color, the inner walls of the school should be painted white so that it is bright, and the lighting should be natural lighting, so adequate natural lighting and adequate water supply. They should have their own independent water supply through piped water supply system with taps. Eating facilities should be provided for the school students, and a lavatory again is very, very important. So the recommendation is around 1 urinal for every 60 students and 1 latrine for every 100 students. Coming to the nutritional services, which is the fifth aspect. So proper proportion of nutrients in a diet is what we need to focus on. So nutritional disorders in India it can be micronutrient deficiencies in terms of vitamins and minerals, and protein energy malnutrition. So we do have certain programs related to nutrition. They are midday school meal program, applied nutrition program, and programs related to specific nutrients. So what is a midday school meal program? So what is its vision, mission? So the vision is healthy and active younger generation. So the midday school meal program focuses on giving healthy and active younger generation, and the mission being enabling children to get maximum benefits from learning environment. So it provides meals. So it focuses on at least one nourishing meal, preferably a morning meal, which should meet 1/3 of the daily calorie requirement and half of the protein requirement. So what is applied nutrition program? So applied nutrition program doesn't provide any food directly to the students, but it helps in providing the vegetables and other grains and seeds. So this is a nationwide village-based nutrition program which was introduced in 1963, and it is assisted by UNICEF. So UNICEF largely supports applied nutrition program. So it helps in terms of supplying seeds, manure and water, and the school authorities will find an appropriate land wherein they using these supplies they cultivate their own vegetables and kitchen gardens. So wherein the students also can be involved, so it can be a learning experience and a teaching method for the students also. So national programs which related to specific nutrients are your vitamin A prophylaxis program, iron supplementation for iron deficiencies, and iodine supplementation for iodine deficiencies. So coming to the next aspect is first aid and emergency care. So the emergencies usually which we come across in the schools are accidents and medical emergencies. And the role of school teacher again is very very important. So the teacher should be trained to handle these accidents and emergencies, and a first aid kit should be provided to each and every school. So coming to what is the seventh aspect of school health service? Mental health. So mental component again is a very very important component of school health. So the common mental health problems are juvenile delinquency, which will be dealt separately in the next class, and maladjustments maybe in school or at home, and drug addictions like your alcohol and various other drugs. Again here role of school teachers are very very important because they listen to the school teachers better than parents at home, and we can also make use of occasional counselors and psychologists with respect to mental health. Then coming to dental health as a eighth aspect of the school health service, the general problems of dental health are dental caries and periodontal diseases. So as a part of school health program, we are supposed to provide annual dental examination for all the students. Coming to eye health services, so the common problems are again your refractive errors, squint, amblyopia and trachoma. So under basic eye health services should be administered, of which vitamin A administration is very very important. Then the 10th aspect of school health services, health education. So no matter how much ever services you provide or you intend to provide will not be utilized by the school students unless they are educated. So health education is a very very important component of school health education. For that matter, health education is an important aspect in every national health program. So same even in school health, it's equally important. So what is the goal of health education? So to bring about desirable changes in health knowledge, in attitudes and in practice, and not merely to teach the children the rules of hygiene. So your health education should be focused in such a way or planned in such a way that you instill knowledge in them, and this knowledge will help them in attaining favorable attitudes, and so that they can put these attitudes into practice. So it is you're instilling knowledge so that they develop favorable attitudes and practice the same. So this is very very important. It is not merely to teach the children the rules of hygiene. So IEC should be done in a very very effective way. And what are the areas to be covered? So you cover with respect to personal hygiene, the environmental health and family health. Now in personal hygiene, what are the things you focus on? Yes, you can see here the first and most important thing is about hand washing. And now I think you all have realized the importance of hand washing with this corona pandemic going on. So but however, hand washing practices were given importance even before. So hand washing before eating and after defecation, is very, very important. And need for hygiene of skin, hair, teeth and clothing should be focused. And they should avoid adopting bad postures. So sitting straight and regular physical activity, exercises are very important. And avoid poor health habits in terms of alcohol, smoking and dietary habits. And environmental health, you have to encourage children to participate in health activities. Like as I said, in kitchen gardens, maybe in immunization programs and fly campaigns. So this will help them learn things in a better way, and they are also involved in it so that they learn it in a better way. And family life education is of course very, very important. So children should be taught about reproduction and about family life, etc., and about safe sexual behaviors or risk factors in terms of HIV and STDs. So all this should be focused on. And here of course the role of school teacher is very, very important. And now coming to the 11th aspect of school health service, which is education of handicapped children. So handicapped children again is a separate topic by itself, which I'll be covering in the next class. But anyway, I will just briefly highlight about what is it you want to educate in handicapped children. So the goal is to assist the handicapped children and their family. So the management requires the cooperation of health, social welfare and educational agencies. For you to manage a handicapped children, so you do expect intersectoral coordination. So what is the last aspect of school health service, which is the 12th aspect, school health records. So we've been speaking about all the 11 aspects of school health service, and no matter, even if we do all the 11 aspects in a very nice manner, but still if you don't record them in any school health records, it is going to be a waste. So we need to have records which are maintained. So the purpose is to have cumulative information on health aspects, to analyze and evaluate school health programs, and to provide a useful link between home, school and community, because we are going